All right, so it's just past 2 now, so I guess we'll get started and other people may trickle in. But for those of you who have not been to a virtual office hours before, my name is Callie and I'm a program coordinator here at the City Health Dashboard. So thank you all for finding some time in your Thursday to come here for the Put Us on the Map Q&A session today. We're really going to be focusing today on how the dashboard can be used for small cities and our Put Us on the Map initiative, which is focused on getting more small cities onto our maps. But before we dive into it, I'll just give you a little bit of more of a background on who we are here at the dashboard and what we do on our site. I'll give you a brief walkthrough of the tool and how you might be able to use it, highlight a few cities from the past, and also get into the actual application process, leaving some time at the end for live Q&A if you guys have any questions. Um, so here at the dashboard, our main goal is to be able to help cities across the US leverage the power of data to improve health and well-being of everyone in their community. So we really focus on trying to get this data out to leaders in the community. So that could be mayors, community health departments, even citizens who just are interested because data really helps move things forward. And something that we often say here at the dashboard is if it doesn't get measured, it won't get done. And that's why we love providing this data for people. We really think that seeing is believing. There are changes that can be made from emotions, but hard data is really what helps to move the needle forward. Without data, leaders are really making decisions in the dark, and historically, there has been a lack of local level data available. And without that data, leaders really don't have the concrete evidence to be able to make these real decisions that affect their community members. So that's why we want to try to provide this data for everyone. So we know that cities exert a strong influence on community members. Their cities are the ones that kind of elect and decide on safe and affordable housing, smoking policies, infrastructure, walkability. A lot of these factors affect the everyday lives of the individuals living within a community. And we heard from city leaders that these are really important aspects of life, such as building roads, bridges, increasing access to broadband, making more safe and walkable communities. And we want to provide the data to make sure that these can continue to improve and really reflect the concerns and needs within a community. So here at the dashboard, we provide data for over 970 cities throughout the US, and we're continuing to grow that number every year. Our Put Us on the Map initiative, which I'll go into a little more detail later today, is one of those ways in which we do continue to add more cities. We have every city right now on the dashboard that has at least 50,000 population or more. And then we're continuing to add cities with smaller populations because we know historically smaller cities have had a more difficult time at getting this local level concrete data. So how do we provide all of these measures of health for the cities? We launched the dashboard back in May of 2018. It was developed here at NYU School of Medicine in the Department of Population Health, and we worked really closely in collaboration with the NYU Wagner School of Policy, as well as some key partners such as NLC and ICMA. And then we also, when we first launched, worked really closely with 4 partner cities. These were our pilot cities, and they really helped us learn what cities really needed from the site and how to create a one-stop resource for cities to create healthier and more equitable communities. So today we're proud to have over 40 measures of health, and we want to make sure that we can bring those to as many members of the community as possible. So our goal is for the dashboard to really be, as I said, an easy to use one-stop resource for every user, including health professionals, city leaders, everyday community members. And we do that by developing and testing our site and metric with a diverse group of community and city leaders. So we're constantly trying to improve upon and upgrade our site. We have data releases to about twice a year that really make sure that our data is the most up to date and the most accurate as possible. We continue to check our metrics and make sure that they're actually timely and our public health priority for our communities that are using the site. We select based on very stringent criteria, so nothing that is posted on the site hasn't gone through a big process already to make sure that it's something we can really get behind and support. We use initial implementation and user testing to ensure that our site is really good for a wide audience. So either someone that's really data savvy or someone who's never even seen data once in their life. We want to make sure that our tool can be used by the wide range of audiences. And on top of that, our website is developed in conjunction with experts that want to make sure that it's very accessible to the users. So we want to try to make sure that we're getting those touch points for everyone who might not be so used to these sorts of sites. And so we created the City Health Dashboard, and the City Health Dashboard can really be used to compare health gaps across neighborhoods and dig deeper into what is causing those differences. It can be used to compare your city to other cities and other regions or with similar population sizes or demographic factors. So it can really help you set the goals and learn from what others are doing around you. And then also can really help provide evidence to set priorities and better target resources to the neighborhoods that may need them the most. So this is an example here in Columbus, Ohio, of a life expectancy measure we have in the map. And you can see that these neighborhoods that are right next to each other have vastly different life expectancies. And so this is something that you can see from our site in either visual or through the numbers. So that's something that you can use our site for. And so when we're choosing measures, we have, as I said, over 40. We always make sure that all of our measures are coming from a national data set that we can really speak for and believe in the underlying data collection. We want to make sure that they're accurate and reflect the public health priorities of the communities. We want to make sure that they're amenable to city level interventions so that it's not just getting the data, but you're really able to move from data to action. We host a data release about twice a year to make sure that they're updated regularly. And all of our metrics are seen across 5 main domains. So these are all of our metrics right now that are currently on the site. And as you can see, they're the 5 main domains: clinical care, physical environment, health outcomes, health behaviors, and then social and economic factors. And now for a variety of our metrics, we also are able to provide demographic breakdown. So this is showing both racial and ethnic breakdowns of the metric as well as by sex. So this gives you an even further look into what is going on in this metric. And then these are color coded as well. So the metrics right now in blue are at the city level. So that's kind of like a higher up city level view. The ones in yellow are both city and neighborhood level. So we've also broken those down by census tract, so you're able to get even deeper into the data to see what you can find. So that being said, I'm now going to give you guys a quick little run through of the actual site to see what we're talking about. So here, when you come to cityhealthdashboard.com, you come to this main page, and here you can see any research we've been involved in, upcoming events, impact stories, and any news. But this is the main search bar where you'll be able to look for your city. So I'll go to my hometown of Burbank, California. And when you're prompted here, you can either select a metric right away if you know which one you want to get into, or if you just want a brief overview, you can just click overview here. And this will show you all the data that's available for your metric for the most recent year of data available. When you click into any specific metric, you're able to do multi-year comparisons. So you can look at, say, 2021 data compared to 2017 as you kind of go through. But here it's just going to show you the most recent year of data. For all of the metrics that have a little check mark, that means the city is performing better than the dashboard city's national average. The dashboard city average is kind of a proxy for a US average. It combines all of the data from all the cities on our site, so over 970. And then you're able to see from there, how is your city doing in comparison? So as you go down, you see that once again, it's broken out by the 5 domains. And today we can look at uninsurance. And so that's a measure of how many people in the community have access to health insurance. So if we click onto the map, you're able to get, again, the city level view. This will now give you a city average for that year. So in 2021, Burbank had about 5.5% of the population, less than 65, who were uninsured. And so you can see that this is doing better than the average of the dashboard cities. You can click into census tracts here to kind of see how neighborhoods are doing comparatively. If you want to star any neighborhoods, you can do that here, and then you can see them in the starred. Clearly, I've been on my hometown before, and if you want to look at a tract that's been starred, you can put a little eyeball here and it will highlight it on the map, so you'll easily be able to see it even if you change between years here. So this is one way to look at the data. If you want to get a little more detail, you can go to demographic detail, and this will break down the metric by those demographic groups that we spoke about before. So for uninsurance, it's actually broken down by age as one of the demographic groups. So here you can see 0 to 18, 19 to 25, 26 to 34, and you can go all the way down and kind of see how the age compares based on the Burbank population of that breakdown of age compared to the dashboard city of that age. It also is broken down by race and ethnicity, and then as well as sex. So you can really go through this and see how's the measure doing for all these categories. And you can go back in time as well, and it will adjust those accordingly based on dashboard city average as well as your own city average. Another cool feature that we have on the site is a compare cities feature. So you're able to compare your city to any other city on the dashboard. And so you can either, if you have a city in mind, you can type it in here, or you can filter it out by certain characteristics. So let's say we wanted to compare to a city that had a similar population size to Burbank, as well as say a similar income federal level. And it'll take a second to load, but we see here now that there's 26 cities that we could compare Burbank to that have a similar population size as well as a similar level of poverty within the city. And here we can then click into any of these cities. So let's say we want to compare to Santa Monica and Norwalk, Connecticut. You can click in here and it will pull up those two comparator cities, and we can see how they're doing compared to Burbank. And then we can also compare all the demographic details for these cities compared to Burbank if you scroll a little down. So this is a really great way to see how communities that might be similar to yours are performing for any particular metric. You're able to change your metric here at any time as well. Another cool feature that we have is not just comparing cities, but comparing metrics amongst themselves. So here we have uninsurance. If we want to say, look at uninsurance and children in poverty, we can do this here. And what it's going to pull up is it's going to pull up a map of the city with one color being the original metric we selected. So that original bluish gradient that we had is going to be representing uninsurance. And then children in poverty is going to be showing up in a gradient of circles. And so if you click into any tract, you'll be able to see the two estimates. You can kind of see how they're doing side by side. If you want a different visual than just the map, you can go down and you can see there's not a ton of correlation here in this map, but it's interesting to see these two measures side by side, and you can do that with any two metrics on the site. The final thing that I kind of want to point out here is this take action resources page. So this page is going to be filtered because we're on a specific city for uninsurance. So any take action resources, these are resources such as policies and programs, strategies, funding opportunities that can help you really move from the data to action within your city. So, you see all this data, it's great, but now what do you actually do with it? This is the page for that. So this is going to be giving you some tips for uninsurance as you go down. It's kind of filtered for that. If you want the main list of all take action, not just for Burbank, you can go here on the left-hand bar to just go here, and you can filter out by any metric you want, any audience type, program policy, evidence rating, and you can click through to some of these different things here. And this is a great resource to explore and really see how can you move your data forward. And then the final thing I kind of want to point out here, which might be helpful for some of you, are the impact stories. So this is how cities have used the data in the past to really move from data to action. So how have they used our data to make change in their community, and what have they seen? And so we've highlighted a few cities here, and we can go in and kind of see, what are the sizes of these cities we're highlighting? What are the metrics they're using? What is the impact that it's made in their communities? And that's a great way to see how this data has been used. So that's a really brief overview of our site. There's a lot more I could get into, and at the end for Q&A, I can also dive into any cities if you want a little more touch base or a little more help as you go through it. But that's just a quick overview. So now I want to get into the actual Put Us on the Map challenge. So this is our third year of hosting the Put Us on the Map challenge. The Put Us on the Map challenge is a free opportunity for residents, local governments, anyone from smaller cities to apply to get their city added to the dashboard. So as I said before, the dashboard has all cities that have a population of 50,000 people or more on the site, but for cities that are smaller than that, because data is not as available, we have to do an application process to be able to make sure that we're able to provide that data for these cities. And so for cities that are interested in getting this free data, free local level data, we host this application every single year to get more cities cities on the site. So far, through this initiative, the last 2 years, we've added nearly 100 cities to the site. And so we're excited to launch it yet again this year and hope to get a lot of applications. You're able to apply for more than one city if you have interest, for instance, in a county. You can apply for multiple small cities. They all just have to be in one application for the same state. If it's multiple states, you have to do multiple applications, but the application is pretty straightforward. Anyone who can apply, the city just has to have a population between 1,000 to 50,000. So somewhere within that range, your population has to land. Any individual or team can apply. It's just we hope that you are being represented by the community members, policymakers, government leaders and staff, students, teachers, really anyone that could be able to use this data and show a use case for why this data could be important for their city to have access to. We love an application that shows cross collaboration, partnerships, a well thought through application of, once we get this data, how can we actually move it forward and use it? So we highly encourage any partnerships or kind of letters of support to also be included. Selected cities that are put on the site will get access to nearly 30 measures of health. So we can't provide every measure of health on the dashboard. We can provide a majority. And this is just due to data collection, and some of them just don't provide data for smaller cities. But for every metric that we're able to, we will give you that data for free. You don't have to do anything more for it. And then you also get access to all website features. So that includes that city comparison feature, that metric comparison feature, demographic information as you look through it. You get access to all of those as well as the take action resources. You also get access to support from the dashboard team. So if you ever have any questions, you could reach out to me, to anyone on my team, and we're able to set up that one-on-one call with you to really walk through the site to help you figure out what can you do with the data. So if you need any support. And then finally, you're also able to be featured in blogs or impact stories. So that impact story page that I showed you before, it really highlights certain cities as examples and kind of inspiration for other cities on how to use this data moving forward. So that could be you and your city. We could also feature you in a blog that might highlight your city and your data and really amplify your name across our channels, which can be really exciting if you're looking for those collaborative opportunities, funding opportunities, anything like that. Getting your name out there really shows that you're doing the work. So this is a list of the data that we are able to provide our cities this year. And so as you can see, the majority of them do provide both neighborhood and city level. Only a few of them are just at the city level. And there are quite a few measures that we're able to provide that demographic information. So these are nearly 30 metrics. And then as data becomes available, we will be able to add more to the site. And so each data release, as data is updated, your city would also be included in that. So you don't have to do any further application. It's just one time, once you're on the site, you get access to everything. So it's a very easy application form, and I'll actually copy that link into the chat in a second, but it's a very easy application form. I believe there's about 4 questions that are a little more written out. And it's just like, why is local data important to your city? What do you hope to accomplish? How might it make a difference in your community? And then we just ask for your name, your job title, kind of like what is your relationship to data for this city, city population size, and then you just send it off to us. If it's not from a government official within the city, we do ask that if possible, you could get a letter of support from a partner within the city. You don't need it though. So if that is a barrier to you applying, we still receive many strong applications without that letter of support. That's just something that can help boost your application. And this year, our deadline for applications, we will be closing them on March 1st, so next Friday at 5 p.m. Eastern time. And so if you're able to get in the application before then, please do. And if you have any questions throughout, outside of this call, feel free to just reach out to me. I'll put my email in chat as well. But yes, it's a very simple application process. Here's an overview of the timeline. So applications are open now. They open on February 1st this year, and they'll be closing on March 1st at 5 p.m. Eastern time. We'll announce the selected cities from this round in April. So sometime in April in that time period, we'll send our announcement. We'll let you know that you're going to get on the site. And then the next data release update that we have upcoming is going to be in June, July. And so in that time, we will actually be launching your city onto the site. So that means come June or July, when we have that data release, your site will have access to up to 30 measures of health immediately for all the years available that we have. You'll get access to everything on the site. Then later that fall, or I guess late summer, July, August, we'll be hosting a webinar specifically for selected cities. And in this webinar, we'll be walking through the site with you. We'll be answering all your questions, and we'll just kind of congratulate you, but also give you that personalized touch on the website. So it'll be something like this, but a little more personalized to small cities, and looking at how can you actually use this data now that you have access to it. And then our support, as I said, is ongoing. So for any city that's been selected for Put Us on the Map, we're here for you, and we're here to help support you on your data journey. So that's just kind of a brief overview. I will now spotlight some cities from the past. So as I've said before, we've had we've had exactly 96 cities added to the site over the past 2 years through the Put Us on the Map challenge. A lot of these cities are small cities that didn't have access to data previously. So it's been really exciting to see and hear from them, to see what are they doing, how are they using the data, and how are they making change within their communities just in the past 2 years alone. So to start out, I'll be highlighting Petersburg, Virginia. They were added to the dashboard in our first year of the Put Us on the Map challenge, so in 2022. And they used the data for two specific things so far. The first thing is that they were looking at some of our healthy food access metric, obesity, diabetes, high blood pressure, and children in poverty. And they were combining all these metrics and really looking at how are those kind of correlated within their community to help them think about where should they be putting their mobile farmer markets. They wanted to create these markets to give more access to healthy food to their community, and they wanted to make sure that they're targeting the neighborhoods that might need this the most. So they were using our metrics to do that. And then another project that they were pursuing is using the Compare Cities feature to see how are other cities working within some of these metrics to think about how they could frame a research project proposal around evaluating community-led structural interventions. And so really looking at how can they address health equity and health disparities in their community. And they were doing that by kind of comparing their cities to other ones that have the similar population or demographic information as theirs to kind of learn from and grow for their own city. Another example is Stafford, New Jersey. So Stafford, New Jersey was a selected city from 2023, so last year. So they've only had access to the data for not even a whole year yet. They were given access in July of last year, and they've already taken huge strides in using this data. They've combined their local data with data from this dashboard to create some really great initiatives within their community. The first one that I want to highlight is this mental health workshop. So they realized that they have a large senior citizen population within their town, and they looked at the frequent mental distress data, which is on the dashboard for their city, and they noted neighborhoods that had the highest frequent mental distress, and they were able to see, some frequent mental distress has been growing within their community, and that led them to create these mental health workshops for seniors, to really focus on making sure that mental health services were accessible to their community, and they were targeting those neighborhoods that needed it the most. A good example of this is using the obesity data from our site. They looked and saw that there had been an increase in obesity, so that encouraged them to host and sponsor more fun runs. So they hosted a 5K this year, and they hope to continue to host more of those to encourage more physical activity within their community. And then finally, they've been looking at a lot of our metrics, both physical environment as well as others, to determine which local health organizations and resources and advocacy groups would be the most helpful to participate in some of their fairs. So health benefits fairs, Green Team, Green Fair, that really looks at what areas do they need the most support in, and so who can they bring in to really help their community. This is a great quote from them, and it's really talking about how they have used the city health dashboard data, but then also combine our data with their local health data. So they're a community that really does a lot of community outreach, and so they have a lot of surveys from members in their community. So now they're able to really see the data that they get, but then they now get that background picture using our data. And by combining those two, they're really able to move forward a lot of their campaigns, and they're using a lot of our data as evidence in applying for their township's mayor's wellness campaign, which provides grant funding to help move forward a lot of these projects. The last example I'll talk about before opening up to Q&A is Decatur, Georgia. So we actually got an application from them last year from their fire department, and they wanted to get to the underlying causes of some of the emergencies. So they get a lot of 911 calls. They also serve EMS, so emergency medical services, through their fire department. So they want to see, we want to take a look at more of a preventative lens and see where are areas in the community that are getting these emergencies the most, and are there any underlying factors that we can address to try to limit these. And so they use our data to combine it with EMS responses, and they're looking at kind of those two data sets together to see which neighborhoods could use the most resources, and then they're using our data on the dashboard as evidence for applying for a grant to be able to give them the resources and that time to start addressing these issues to hopefully take off some of the stress of their community and help improve wellness. And this is another wonderful quote, but this time from Decatur, and it's just showing how they're really trying to look at a more equitable lens of health in their community, and the dashboard is really helping them to do that. So that was a lot of talking on my end. I wanted to open the floor to all of you and see if you had any questions in regards to the application, to the dashboard. I'm happy. It's a pretty small group today, so if you guys want me to walk through anything specifically on the site or specifically walk through the application, I'm happy to do that. Feel free to take yourself off mute or just pop any questions into the chat and I'll be sure to address them. I see we have our first question here. How is data collected? How often is it updated? And what role would the health department have in this program? I'm assuming HD is health department. So each data set, all the data is taken on our site from national data set sources. And so you can see more information. I'll just take you to the site right now. But if you go here to metrics background page. So this will give you a little more of an outline of each metric, specifically where the data is coming from, what is that data source. So for instance, the breast cancer deaths data right here, it's coming from the New Jersey State Health Assessment for New Jersey states, or it's coming from NVSS, or the National Vital Statistics System. So that's a national data set. And so we get access to that, and we get that data, and everyone, I think, pretty much can have access to a lot of these data sources, but it's usually aggregated at that state or county level. What we do on our team is then we take that data and we aggregate it down to that local community and city level. So you're able to see where is that original source. We vet all of our sources. We make sure that they're very good and pure sources of data. And then we let you know how do we calculate it. If you want even more information, you can also click into a specific metric. It takes you to what we call the metric one pager. This is a background page of that metric. It'll show you the dashboard city average here. It'll give you a little more information about why we think this is a metric that's valuable to show on our site, some of the strengths and limitations of that particular metric. Sometimes it's the way the sample was done. Sometimes it's, why this is an important metric to measure. It will also give you the specific formula so that how do we actually calculate this on the back end? If you want even more information, we also have a technical document, which is this huge document that basically outlines every step that we took when calculating it, every little potential indicator on the site, which is like if there's any cautions you might need to take or data tips to help you better understand it, you can find that on the technical documentation. And how often is it updated really depends on the underlying data source. So for some of these measures, for some metrics, they're only updated with the census. And so the census is every 10 years. So sometimes it's a little long, but usually it's every year there's an annual update based on the amount of aggregation. So some metrics on our site are like 3-year estimates, 5-year estimates. So every time we have an update, we will make sure to add that to our site in the upcoming release. And usually we have about 2 releases each year of data update on the site. If a measure is updated on the site, when you go here and let's go back to say Burbank, it'll say if a measure has recently been updated. So our last data release was at the end of December. So you can see here, these metrics were actually the ones that were updated most recently in that release. I see there's another question in the chat. If you have any other follow-up from that, feel free to throw it in the chat, but I'll move to the next question now. How many cities do you anticipate adding through this initiative? If submitting applications for multiple cities, should we submit one application per city or list all on one application? So each year that we've done this, so we've only had the challenge for 2 years. Each year that we have done this, we've basically doubled the amount of applicants, which is amazing, and we hope to continue getting more and more applicants. We don't have any cut off this year. The first year that we did it, we cut off at I think 25 cities that we were accepting. Now we've kind of realized, if cities want the data, we want to be able to give it to them. So we want to make sure that if there's a solid case for why the city should be added to the site, we want to give them that opportunity. And so we don't have any cutoff for how many cities can apply, and therefore I'm not sure how many we will get. I will say as of now, we have about 40 cities that have applied, which is really exciting. And we hope to see even more in the next weeks, or I guess next week. If you are submitting applications for multiple cities, it's really up to you if you prefer to do multiple applications or just one. I personally think if you're the same person applying for multiple cities and they're all within the same state, it's easier to apply in just one application because then you don't have to kind of like recopy all of the information. And that actually makes me remember that I did not share with you guys yet the actual application link. So I'll do that now. But here, the application, as I will show you here, it's, has a little background, but it's really simple. You'll just put in the name of your town. You'll add some information about you, as well as there's these actually, it's only 3 questions. I thought it was 4, so that's easier. There's these questions that require a bit more thought and time than just simply putting information down. And so for these questions, it's a little easier to just do one application if you're the same person applying. If your city is in a different state, then I would say do multiple applications so that you make sure that we're capturing the right city. I'll send this in the chat now for anyone interested in the actual application form. And I'll actually also send this blog in the chat, which gives more information specifically about the challenge, eligibility, timeline, and everything like that. Any other questions? And I'll stay on the whole time, so till 3 o'clock if anyone has any other questions, want me to walk through anything more specifically. And as always, pop them in the chat, take yourself off mute. But in the meantime, if you don't have anything else, I'll be sure to send around this recording for everyone if you want to walk through it again or watch anything. But in the meantime, make sure that you're subscribed so that you hear about the challenge in the future, hear about any other upcoming things. And we also have social media, so Twitter or X as well as LinkedIn, where we do share announcements such as new cities being added, timeline, deadlines for this application period. And then also please, look around the City Health dashboard. I'll send the subscribe link right now, as well as my email in the chat in case you have any other specific questions for me. Oh, it did not link, but. And then also my email address if you have any questions specifically. And thank you guys for joining.